CEN Written Exams Quiz. Question 1. A patient with an orbital fracture presents with diplopia, ophthalmos, and subconjunctival hemorrhage. Which complication should the CEN suspect? Option A, optic nerve damage. Option B, globe rupture. Option C, entrapment of extraocular muscles. Option D, all of the above. The correct answer is option D, all of the above. Orbital fractures can cause entrapment of extraocular muscles, leading to diplopia and restricted eye movement, ophthalmos, and possible optic nerve damage or globe rupture. A thorough ophthalmological examination is needed. CT scan of the orbit is the diagnostic test. Surgical intervention may be needed for entrapment and ophthalmos. Question 2. A patient with SVT has failed vagal maneuvers. The CEN should prepare to administer. Option A, adenosine 6 mg 4 push. Option B, atropine 1 mg 4. Option C, epinephrine 1 mg 4. Option D, amiodarone 300 mg 4. The correct answer is option A, adenosine 6 mg 4 push. Adenosine is first line for stable SVT. It is given as a rapid 4 push, 1 to 2 seconds, followed by a 20 ml saline flush. Atropine is for bradycardia. Epinephrine is for cardiac arrest. Amiodarone is for ventricular arrhythmias. Adenosine works by transiently blocking AV node conduction. Question 3. A patient presents with a foreign body sensation in the eye, tearing, and photophobia. The CEN should: Option A, use a slit lamp to examine the eye. Option B, perform fluorescein staining and a slit lamp exam. Option C, irrigate the eye. Option D, all of the above. The correct answer is option D, all of the above. A corneal foreign body or abrasion requires a thorough examination under a slit lamp with fluorescein staining to identify the location and extent of the injury. Irrigation may be needed to remove loose foreign bodies. The CEN should identify and remove the foreign body if visible or refer to ophthalmology for removal. Antibiotics are often prescribed. Question 4. A patient presents with acute pelvic pain, fever, and cervical motion tenderness. Which diagnosis is most likely? Option A, ovarian cyst. Option B, pelvic inflammatory disease, PID. Option C, endometriosis. Option D, ovarian torsion. The correct answer is option B, pelvic inflammatory disease, PID. PID is an infection of the female reproductive organs, usually caused by sexually transmitted infections, chlamydia, gonorrhea. It presents with pelvic pain, cervical motion tenderness, chandelier sign, fever, and abnormal vaginal discharge. Treatment involves antibiotics, broad spectrum. PID can lead to infertility, ectopic pregnancy, and chronic pelvic pain if untreated. Question 5. A patient with an asthma exacerbation has a peak expiratory flow rate, PEFR, of 40% of predicted. Breath sounds are quiet, and the patient is using accessory muscles. The CEN should recognize this as: Option A, mild exacerbation. Option B, moderate exacerbation. Option C, severe exacerbation. Option D, life-threatening asthma with impending respiratory failure. The correct answer is option C, severe exacerbation. A PEFR of 40 to 50% of predicted indicates a severe asthma exacerbation. Signs include dyspnea at rest, use of accessory muscles, and quiet breath sounds. Treatment includes continuous nebulized beta agonists, ipratropium, systemic steroids, and consider magnesium sulfate. A PEFR 33%, confusion, or a silent chest indicates life-threatening asthma, which may require intubation. Question 6. A patient presents with epigastric pain radiating to the back, nausea, and elevated lipase. Which diagnosis is most likely? Option A, gastritis. Option B, pancreatitis. Option C, cholecystitis. Option D, peptic ulcer disease. The correct answer is option B, pancreatitis. Acute pancreatitis presents with epigastric pain radiating to the back, nausea, vomiting, and elevated lipase, 3 times the upper limit of normal. Common etiologies include gallstones and alcohol use. Management includes 4 fluids, pain control, NPO status, and treatment of the underlying cause. Question 7. A patient presents with acute chest pain, shortness of breath, and a pericardial friction rub. Which ECG finding is most characteristic? Option A, ST segment elevation in all leads. Option B, PR segment depression and diffuse ST elevation. Option C, Q waves in leads 2, 3, AVF. Option D, tall, peak T waves. The correct answer is option B, PR segment depression and diffuse ST elevation. Pericarditis is inflammation of the pericardium, presenting with acute chest pain, pleuritic, better leaning forward, a pericardial friction rub, and diffuse ST segment elevation, often concave upward, with PR segment depression. It is distinguished from STEMI by the lack of reciprocal ST changes and the diffuse nature of ST elevation. Treatment includes NSAIDs, colchicine, and steroids if refractory. Question 8. A patient presents with a sudden onset of sharp, pleuritic chest pain and shortness of breath, but no trauma. Lung sounds are decreased on the left side. What diagnosis should the CEN suspect? Option A, spontaneous pneumothorax. Option B, pulmonary embolism. Option C, pericarditis. Option D, pleurisy. The correct answer is option A, spontaneous pneumothorax. Spontaneous pneumothorax occurs without trauma, often in young, tall males or patients with underlying lung disease, COPD, asthma. It presents with sudden, sharp pleuritic chest pain and dyspnea, with decreased or absent breath sounds on the affected side. Management includes observation, supplemental oxygen, or chest tube placement depending on size and symptoms. Question 9. A patient with a suspected hemorrhagic fever, e.g., Ebola, should be managed with Option A, strict contact and droplet precautions. Option B, airborne precautions. Option C, standard precautions. Option D, enhanced contact and droplet precautions. The correct answer is option D, enhanced contact and droplet precautions. Hemorrhagic fevers, Ebola, Marburg, Lassa, require a high level of isolation, enhanced contact and droplet precautions, including double gloves, impermeable gowns, face shields, and shoe covers. These patients should be in a single room with dedicated equipment. The CEN should follow the facility's protocol for high-consequence infectious diseases. Airborne precautions may also be used in some settings. Question 10. A patient with hypothermia, core temperature 30 degrees Celsius, is unresponsive. The CEN should Option A, rewarm the patient with active external Ruhrmetting, e.g., warm blankets. Option B, rewarm with active internal Ruhrmetting, e.g., warm 4 fluids, warm humidified oxygen. Option C, administer 4 antibiotics. Option D, defibrillate for VF. The correct answer is option B, rewarm with active internal Ruhrmetting, e.g., warm 4 fluids, warm humidified oxygen. Hypothermic patients with temperatures below 32 degrees Celsius are at risk for cardiac arrest. Active internal Ruhrmetting is the priority. External Ruhrmetting can cause afterdrop or Ruhrmetting shock, peripheral vasodilation causing hypotension. Defibrillation may be attempted for VF, but if the patient is severely hypothermic, the heart may not respond until Ruhrmetting is initiated. Management is supportive. Question 11. A patient presents with a bowel obstruction, nausea, vomiting, abdominal distension, and obstipation. Which imaging study is preferred? Option A, abdominal X-ray. Option B, CT scan with oral contrast. Option C, ultrasound. Option D, MRI. The correct answer is option B. CT scan with oral contrast. CT with oral and for contrast is the preferred imaging for suspected bowel obstruction, as it can identify the location, cause, and complications of obstruction. Abdominal X-ray may show air fluid levels but lacks specificity. Ultrasound and MRI are less sensitive. Management includes NPO status, NG tube placement, for fluids, and surgical consultation. Question 12. A patient with a psychiatric emergency is placed on a legal hold, e.g., 5150. The CEN should: Option A, allow the patient to leave if they are calm. Option B, inform the patient they are on a legal hold and document. Option C, call the police to discharge the patient. Option D, ignore the legal hold. The correct answer is option B. Inform the patient they are on a legal hold and document. Patients on a legal hold, involuntary psychiatric hold, are not allowed to leave until they are evaluated. The CEN should inform the patient of the hold and document the process. The patient must be kept safe and in a monitored environment. The hold is a legal order, and leaving would be against the law. The CEN should not discharge the patient. Question 13. A patient with sepsis has a MAP of 55 mmHg despite fluid resuscitation. The CEN should anticipate which vasopressor? Option A, dopamine. Option B, norepinephrine. Option C, phenylephrine. Option D, epinephrine. The correct answer is option B. Norepinephrine. Norepinephrine is the first-line vasopressor for septic shock. It increases MAP through vasoconstriction and is preferred over dopamine due to a better safety profile. The sepsis protocol recommends early broad-spectrum antibiotics, within 1 hour, 30 ml/kg crystalloid, and vasopressors for fluid refractory shock. MAP target is 65 mmHg. Question 14. A patient with capacity refuses life-saving treatment and wants to leave against medical advice, AMA. The CEN should: Option A, allow the patient to leave after documentation and ensuring the patient understands the risks. Option B, restrain the patient and start treatment. Option C, call the family to persuade the patient. Option D, call security. The correct answer is option A. Allow the patient to leave after documentation and ensuring the patient understands the risks. Patients with decision-making capacity have the right to refuse treatment and leave AMA. The CEN should document that the patient was informed of the risks of leaving, and the benefits of treatment, and that they understand. The patient should sign an AMA form. Restraint and treatment without consent are only permissible if the patient is a danger to self or others, e.g., suicidal, psychotic. Question 15. A patient presents with a near-drowning event. The CEN should be aware of which complication? Option A, aspiration pneumonia. Option B, pulmonary edema. Option C, hypoxia. Option D, all of the above. The correct answer is option D, all of the above. Near drowning can lead to aspiration pneumonia, pulmonary edema, and severe hypoxia, which may progress to ARDS. The priority is airway management, oxygen, and treating any underlying causes, e.g., cervical spine injury. The patient should be monitored for respiratory distress, electrolyte abnormalities, and neurologic injury. All of these complications are possible and require monitoring. Question 16. Which of the following is an ethical principle in emergency nursing? Option A, beneficence, doing good. Option B, non-maleficence, doing no harm. Option C, autonomy, patient's right to decide. Option D, all of the above. The correct answer is option D, all of the above. The core ethical principles in emergency nursing include beneficence, doing good for the patient, non-maleficence, avoiding harm, autonomy, respecting the patient's choices, and justice, fair treatment. These principles guide nursing practice and decision-making. The CEN should respect these principles in all patient interactions. Question 17. A patient presents with a sudden onset of fever, chills, and hypotension. The patient is a chemotherapy patient and has a central line. The CEN should suspect: Option A, sepsis, bacteremia. Option B, febrile neutropenia. Option C, anaphylaxis. Option D, pulmonary embolism. The correct answer is option B, febrile neutropenia. Patients with chemotherapy-induced neutropenia are at high risk for infection and sepsis. A single temperature 38.3 degrees Celsius, or 38 degrees Celsius for more than 1 hour, is an emergency. Cultures, blood, urine, sputum, should be obtained, and broad-spectrum antibiotics should be given promptly. The patient is at high risk for bacteremia and septic shock. This is a medical emergency. Question 18. A patient with a known abdominal aortic aneurysm, AAA, presents with sudden onset of severe back pain and hypotension. What is the priority action? Option A, obtain a stat abdominal CT. Option B, prepare for emergent surgical repair. Option C, administer 4 fluids to restore blood pressure. Option D, obtain a 12-lead ECG. The correct answer is option B, prepare for emergent surgical repair. Sudden back pain and hypotension in a patient with a known AAA is a ruptured AAA until proven otherwise. This is a surgical emergency. Immediate surgical consultation is the priority. CT may confirm but should not delay surgical preparation. 4 fluids should be given cautiously, permissive hypotension, to avoid increasing bleeding before surgical control. ECG is not the priority. Question 19. A patient with DKA, diabetic ketoacidosis, has a blood glucose of 500 mg/dl, pH 7.2, and bicarbonate 14 milliequivalent/L. The CEN should anticipate: Option A, 4 insulin bolus. Option B, 4 normal saline and insulin drip. Option C, bicarbonate infusion. Option D, potassium replacement. The correct answer is option B, 4 normal saline and insulin drip. DKA management includes 4 normal saline fluid resuscitation, continuous 4 insulin infusion, and monitoring of electrolytes, especially potassium. Bicarbonate is not routinely recommended unless pH 7.0. Potassium depletion is common and should be monitored and replaced before insulin treatment, as insulin drives potassium into cells. Insulin is given as a continuous drip, not a bolus. Question 20. A patient presents with a fracture of the tibia and fibula after a motor vehicle accident. The patient has a palpable pedal pulse and sensation. What is the initial action? Option A, reduce the fracture. Option B, apply a splint to immobilize. Option C, apply a tourniquet. Option D, perform a neurovascular assessment. The correct answer is option D, perform a neurovascular assessment. The first step in any fracture assessment is a neurovascular assessment: pulses, sensation, movement, color, temperature. Even if the pulses are palpable, the CEN should document the baseline to monitor for changes. Splinting is important to prevent further injury, but neurovascular assessment comes first. Tourniquet is for bleeding control, not for fractures. Question 21. A patient with bipolar disorder in a manic episode is speaking rapidly, pacing, and expressing grandiose ideas. The patient is not responding to redirection. The CEN should: Option A, put the patient in a quiet, low-stimulation room. Option B, administer haloperidol 5 mg IM. Option C, call security immediately. Option D, discharge the patient home with a referral. The correct answer is option A, put the patient in a quiet, low-stimulation room. Patients in a manic episode benefit from a quiet, low-stimulation environment to reduce overstimulation and agitation. Redirection and verbal de-escalation should be attempted first. If the patient is a danger to self or others, medications, haloperidol, olanzapine, or restraints may be needed, but the least restrictive measures should be used initially. Discharge is not appropriate in an acute manic episode with safety concerns. Question 22. A patient with pulmonary embolism has a Wells score of 6. What is the most appropriate diagnostic test? Option A, D-dimer. Option B, CT pulmonary angiography, CTA. Option C, V/Q scan. Option D, chest X-ray. The correct answer is option B. CT pulmonary angiography, CTA. In patients with a high pre-test probability for PE, Wells score 4, CTA is the diagnostic test of choice due to its high sensitivity and specificity. D-dimer is useful in low probability patients to rule out PE but has low specificity. V/Q scan may be used if CTA is contraindicated, e.g., renal failure. Chest X-ray may show other causes but is not diagnostic for PE. Question 23. A patient with a seizure disorder is in status epilepticus. The CEN should administer. Option A, lorazepam, Ativan, 4 mg 4. Option B, phenytoin, dilantin, 20 mg/kg 4. Option C, midazolam, Versed, 10 mg IM. Option D, valproic acid 20 mg/kg 4. The correct answer is option A. Lorazepam, Ativan, 4 mg 4. Lorazepam is the first-line treatment for status epilepticus. It is a benzodiazepine that terminates seizures. If the seizure continues, phenytoin or fosphenytoin is given. Midazolam may be used if 4-access is not available, IM. Valproic acid is a third-line option. Airway management and ABCs are priorities. Question 24. A patient presents with anxiety, palpitations, and a feeling of impending doom. Vital signs: HR 110, BP 140/90, RR 22. The patient reports a stressful event. The CEN should: Option A, rule out medical causes, ACS, PE, hyperthyroidism, etc. Option B, administer a benzodiazepine. Option C, reassure the patient and send home. Option D, perform a psychiatric evaluation. The correct answer is option A. Rule out medical causes, ACS, PE, hyperthyroidism, etc. Many psychiatric symptoms, panic attacks, anxiety, hyperventilation, can mimic medical emergencies. The CEN must rule out medical causes like ACS, PE, hyperthyroidism, and thyrotoxicosis before treating the patient for anxiety or panic disorder. An ECG, labs, thyroid, glucose, and appropriate imaging should be considered. Once medical causes are ruled out, anxiolytics may be considered. Question 25. A patient with a stroke is being transferred to a comprehensive stroke center. Which law applies to the transfer? Option A, EMTALA. Option B, HIPAA. Option C, OSHA. Option D, ACA. The correct answer is option A. EMTALA. EMTALA governs the transfer of patients between hospitals, ensuring that patients are transferred only after they have been stabilized, or if the benefits of transfer outweigh the risks, and that the receiving facility has accepted the patient. The transfer must be done with appropriate documentation and personnel. EMTALA applies to emergency care.